I think it's really important that we ethically do the research, but that we move forward. If we want to end cancer in a dog's lifetime, i.e. in the next 20 years, which is the goal of this campaign that you're all helping on, then we have to do it very carefully, in a controlled way, and we have to do it in partnership with everyone who's bringing their family to us to treat. We have to make sure that we're not violating that trust. There are really good resources out there is the National Library of Medicine. It's all paid for by your tax dollars, and that's every single real research article that's ever been published is on there. And so if you go to PubMed, so it's public medicine, pubmed.gov or pubmed.org, I think it all goes to the same spot. You can type in dog and osteosarcoma on the search, and it'll bring you up every scientific article and give you a summary of it, a short summary. And you can click on them and see some of the articles are available free online, some are owned by the journals, and you have to pay to get them. But how do you find the clinical trials that are going on? Well, one, you can talk to your local vet who may know about some clinical trials in the area. We maintain a website, if you go to the vet school's website at UC Davis, that lists all the clinical trials that we're currently involved in. Information is available on the Morris Animal Foundation website as well about the clinical trials and all the research that they support. There's over 200 studies that they're supporting right now, and about 20 cancer-related studies are being currently supported. And so this information is out there. You may have to look a little bit. You know, one of the big problems we have is there's not enough money to do the research, and it's tough economic times. It's harder to get money. If we want these studies to go on, you know, they have to be supported. So when you look on our website, you'll see whether or not a trial is funded or not, and then also who funds it. Any lump or bump, particularly anything that grows, should be checked. How we generally check them and how I think it's worth doing is, well, one, we've got a little map for every patient that we do, and it's basically just a little sketch of them, and then we draw on there where the lumps are, we measure them, and then we put a needle in them and aspirate them and take a look. Because while the majority of masses in the subcutaneous tissues, i.e. just under the skin, when you feel them, they feel fatty and they move, well, most of them will be lipomas or fatty tissue. The only way to really tell is to put a needle in it, look under the microscope, see if there's fat cells there, or see if there's cancer cells there. So that's important. So every lump and bump should be checked, just like on you. So how often should you have those fatty lumps checked? If they've been checked once and they're not growing, then you're fine. If they've checked them and there's a change in it, then it should probably be checked again. One of the most important things is early detection. The sooner we see something, the sooner we find out it's something we have to deal with, the better we're going to be able to treat that type of cancer. The warning signs of cancer will be things like a new mass or new lump, a new bump that you find. It could be under the skin, it could be in their mouth, it could be on their toe. Any of those things, if you notice a big change in appetite, if you notice weight loss, those are all signs that you should get your dog to the vet more frequently than the once yearly checkups that you're going to be doing as part of your normal care. And so early detection is really important. So if there's a change, that's when you get it checked again. Something I do, and I'm probably a little overzealous, is we do yearly blood panels, just regular panels on my dogs, just to make sure things are going okay. I think general screening is good. I think going to your vet for your yearly physical is really important because they're going to listen with their stethoscope to the lungs. They're going to palpate the abdomen to see if they feel any lumps or bumps inside. They're going to check all the lymph nodes and feel if any of those feel enlarged. At what age should dogs have their screening done more than once a year is the question? So I think once a year is very reasonable unless we found a specific disease process going on. What we do is once a patient who's had cancer, we generally, when we're done treating them, I usually see him in a month, I see him at 3 months, I see him every 3 months for a year, then I put him on 6 months rechecks. And a lot of times people don't want to go to the 6 month rechecks, they want to stay on the 3 month rechecks. Most people, I'll tell you, when they're out 2 years, still want to come in for regular tests and screening. You put your hands on your dog and you look for new bumps. Particularly, she mentioned, and I agree, that if your dog wasn't spayed early, they've got up to a 25% chance of developing some sort of breast cancer in their lifetime. And so checking along the mammary chain, or just feeling for any little lumps or bumps monthly. Do it when you pay the mortgage, or do it when you do the heartworm medication. I wanted to thank you all again for coming out and walking and supporting the Morris Animal Foundation and supporting the hard work. And thanks, Sandy, again for organizing this, and thank you for inviting me down to speak.
Sandy Vilahu. She is the brains and the passion and just the outstanding person who put this together today. She's just one of the most passionate, giving people I've ever met. She unfortunately lost 3 dogs to cancer, and she took that experience and turned it into something positive. And she also wanted everyone to be educated on what's going on. So I just want to say on behalf of Morris Animal Foundation, thank you so much. We appreciate your commitment to the Morris Animal Foundation and to the Canine Cancer Campaign. Thank you.
Brenna, Roxy, and Cody, this is for you, babies. I miss you.